Welcome to our DVD on foot reflexology. It has been created to accompany the book, The Complete Guide to Reflexology, and all the theory and techniques mentioned here are covered in more detail in the book. The idea of this DVD is to simply give you a better idea how to perform basic reflexology techniques on the feet, and it does not in any way replace proper formal training in this therapy. Reflexology is a gentle, non-invasive therapy that encourages the body to balance and heal itself. It is based on the concept that the hands and feet are mirrors of the body, and that through applying direct pressure to specific points on them, the body can be restored to homeostasis. To understand this concept, it helps to firstly divide the body into what reflexologists call zones. In reflexology, we work with two different types of zones, longitudinal zones and transverse zones. We will firstly look at the longitudinal zones of the body. The body can be divided into 10 energy zones or pathways that run the length of the body from the top of the head to the tips of the toes and fingers. If the energy in one of these zones is blocked or congested and cannot flow easily, then disease can occur. There are 10 zones in the body, and 5 run into the right foot and 5 into the left foot. The easiest way to remember the zones is to start counting the toes, with the big toe always being toe 1. Zone 1 then starts with the big toe. Zone 2, the second toe. Zone 3, the third toe. Zone 4, the fourth toe, and the fifth, or baby toe, zone 5. Also, be aware that the zones running through the body all converge in the head. This means that the big toe, which represents the head in reflexology, in addition to being called zone 1, also contains 5 zones within itself. The transverse zones divide the body horizontally into the head, chest, abdomen and pelvis. These zones are divided by transverse lines, often called body relation lines. These transverse zones not only help you to locate the different organs and structures of the body, they also provide a basis for your reflexology treatment. Looking at the foot, you will see that the toes represent the head, and where they meet, the rest of the foot is the shoulder line. The ball of the foot represents the thoracic area of the body, and where the colour and texture of the skin changes is the diaphragm line. The arched area of the foot represents the abdomen and is divided into the upper and lower abdomen by the waistline. Finally, the heel of the foot represents the pelvis of the body. Also be aware that the lateral or outer edge of the foot reflects the outer edge of the body, and here you will find the shoulder, elbow, knee and hip reflexes. The medial or inner edge of the foot, where you will find the arch of the foot represents the medium or midline of the body. Here you will find the reflex for the spine. Before starting a reflexology treatment, there are 2 things you need to do. Firstly, you need to clean the feet, and secondly, you need to read the feet. There are many different products available for cleaning the feet. What is important is that you clean them properly, and as you clean them, check for any local contraindications and areas you need to avoid touching. For example, fungal infections, which are commonly found on the nails or between the toes. Once you have cleaned the feet, do a reading of the feet. Your feet are more than simply structures upon which you walk. They are a mirror of your body and your soul, revealing your health, your energy, and even your emotions. Through looking closely at one's feet, you will discover that every little detail is telling you something about that person. A mole, a bunion, even a verruca is telling you what is going on inside your client. We are now going to take a look at a few different relaxation techniques. Because relaxation is an integral part of reflexology, it is important to spend the first few minutes of every treatment using techniques that help loosen up stiff feet, improve circulation, and give your client time to unwind before you begin working deeper reflexes. Following are a few relaxation techniques that you can use at the beginning of the treatment to unwind your client. During the treatment, if your client has a negative reaction to the deeper pressure techniques, or at the end of a session to close off the treatment and to ensure your client is relaxed and balanced. The way in which you first touch your client's feet will set the tone for the entire treatment, so take your time and gently, yet firmly, welcome your client's feet by spending a few minutes working their solar plexus in sync with their breath. Reflexology is a simple, almost instinctive technique that encourages deep relaxation and promotes circulation. You can work one or both feet at the same time, and with long, stroking movements, simply massage the feet. Slapping or creating friction on the sides of the feet is another technique that encourages circulation and promotes the flow of energy throughout the body. Foot squeezing. Foot squeezing is a firm, fast technique that is extremely beneficial to circulatory disorders. The secret behind this technique is in its speed and firmness. It should feel as if you're trying to squeeze and pump the blood out of the foot. The ankle boogie is a very powerful technique that releases tension in the hips and spine. Please note that because it is such a vigorous technique that focuses on the hip and pelvic reflex areas, it is contraindicated in pregnancy and for very elderly, frail or arthritic clients. Working the ankles helps to release any tension in the pelvic area, including the hips and sacral spine, and encourages circulation to the reproductive organs. The entire lower leg, especially the calf muscle, can be massaged with deep, flowing techniques such as effleurage and kneading. Please note, however, that deep work to this area is contraindicated in a pregnant client, as there are vital acupoints here that are used to stimulate uterine contractions. The spinal twist is a strong technique that releases tension and helps relieve backache. However, it is contraindicated if your client has arthritis in the foot. The shoulder sandwich is a warming and relaxing technique that releases tension in the neck, shoulders and thoracic spine, and that also helps with respiratory and stress-related disorders. Working or manipulating the metatarsals opens up the chest, deepening breathing and helping relieve tension. Intercostal sliding is a technique that helps to relax the chest muscles, open up the thoracic cage and encourage deep breathing. In doing this, it helps with breathing difficulties, respiratory problems and stress-related conditions. The toes are the reflexes for the neck, and through stretching and rotating them, you release tension and stiffness in the neck and shoulders. This technique also helps relieve sinusitis and is very good for conditions of the nervous system. Please note, however, that it is contraindicated if there is any arthritis in the toes. Pressure techniques form the basis of your reflexology treatment, and although it takes a while to master them, if you are doing them correctly, they should always feel comfortable and easy. Thumb walking forms the basis and bulk of almost every reflexology treatment. Unfortunately, it is also the technique that often damages reflexologists' thumbs because it is so frequently done with the hand held in the wrong position. To find the correct hand position, place your hand on a table with your palm facing downwards and completely relaxed. You will notice that your thumb does not lie down flat. Instead, it rests on its edge. This is the edge of your thumb that you will use when thumb walking. Now, using the edge of the thumb, bend and straighten the thumb so that it moves along in a tiny crawling movement. Try practicing thumb walking on your own hand before you try it on someone's foot. This will give you a chance to get used to the movement. Thumb rotation is a similar movement to thumb walking, but there are two fundamental differences. The tip and not the edge of the thumb comes into contact with the foot, and the movement involves a rotation on each point. Finger walking. Reflexologists usually work the sole of the foot with their thumbs and the top or dorsum of the foot with their fingers. Finger rotation is similar to thumb rotation, except that the finger is used. To give your fingers and thumb a rest, try using your knuckles. You will find they are powerful tools that give a lot of depth and pressure to a treatment. The thumb hook is probably the deepest and strongest of all the techniques you will learn, and it must be used with care, both for your client and yourself. Save it for reflexes that need to be worked deeply. We are now going to put some of the techniques you have learned into practice and show you how to work the different reflexes of the body. Please note that what you are about to see is not a full routine. As mentioned earlier, the toes are the reflexes for the head and neck. They can be worked by placing your thumb and index finger on either side of the toe and, with small circles, moving slowly up the toe. The tips of the toes can be knuckled. When working the toes, remember that you are working the eyes, ears, nose, mouth, throat, sinuses and the pituitary, hypothalamus and pineal glands. In the webbing between the toes lie the reflexes for the lymphatics of the upper body. Squeeze this webbing to help drain the lymph. The shoulder line can be thumb walked or thumb rotated, and then a deep downward pressure can be applied to the reflexes for the ears and eyes. The reflexes for the outer ear are found between toes 5 and 4. The reflexes for the inner ear are found between toes 4 and 3. And the reflexes for the eyes are found between toes 3 and 2. Once you have worked the reflexes of the head and neck well, you can move onto the ball of the foot. which is that thoracic region and includes reflexes for the heart, lungs, bronchi and esophagus, as well as the thymus gland. To work the thoracic area well, try to use a variety of techniques such as thumb walking, thumb rotations and knuckling. In addition to your normal techniques, the heart reflex can be worked with large, gentle circles. This technique can be extremely calming if done slowly and carefully. The diaphragm is a vital reflex and should be worked deeply in every treatment. Thumb walk it repeatedly or do thumb rotations on it. The solar plexus can be worked in many different ways, and what is important here is to remember to use your support hand to provide leverage and thus depth to your techniques. The area between the ball of the foot and the heel holds the reflexes for all the abdominal organs and should be worked repeatedly with a number of different techniques. Try thumb walking or rotating this area in both transverse and longitudinal directions. Also, use your knuckles to work this area and give your thumbs a bit of a break. The heel of the foot is the reflex for the entire pelvic region, and because of its thick skin, knuckling is the easiest and probably deepest technique you can use here. The urinary system can be worked as one unit. Start by applying thumb pressure to the kidney reflex. Once you have worked this reflex, angle your thumb downwards and thumb walk or rotate down the ureters to the bladder reflex. You can then thumb walk or rotate the bladder reflex a number of times. The arch of the foot is the reflex for the spine, and it should be worked in every single reflexology treatment, no matter what the aim of the treatment. Working this reflex relaxes the client and releases tension along the length of the spine. It is beneficial to all disorders of the nervous and musculoskeletal systems. Try to vary the techniques you use on the spine. You can walk or rotate up and down the spine with either your thumb or finger, and you can also knuckle the spine to give your thumbs a break. No matter which techniques you use on the spine, ensure you always support the foot you are working on so that you can work the spine deeply and accurately. Along the lateral or outer edge of the foot lie the reflexes for the shoulder, elbow, knee and hip. As with the spine, you can use a variety of techniques to work this area. For example, you can use your thumbs or fingers to walk or rotate up and down the reflexes, or you can use your knuckles. Beneath the lateral malleolus is the reflex for the ovaries or testes. and beneath the medial malleosus is the reflex for the uterus or prostate. The fallopian tubes or vas deferens connects the reproductive organs. These reflexes can be worked with both thumb or finger techniques. The sciatic nerve forms a stirrup that runs behind the ankles and across the centre of the heel. It is easiest to thumb walk this reflex.